crazy. Hi, folks. Welcome, welcome. I'm here. So just stay put, okay? All right, welcome, folks. Good evening. I'm hoping that lots of people are already joining us. Of course, you are tuned into, I'm still fixing my collar, imagine. So you can imagine it's Friday night and I'm supposed to be relaxed, but I'm not because this is the first program for 2021. Yeah, 2021. And I have had a normal day, a normal work day that you can well imagine. And so I've had to do all the logistics and to get here. I'm hoping that you guys can hear me. If you can, I'd like to know. So I'm going to check out the comments section. If you guys are with me tonight, feel free to send me a message to say, hey, we're hearing you, a thumbs up or something that I can know that you are hearing me. Because I want when our guests come that you can hear them too. All right. So just let me know. Welcome. I like to play a little welcome music for some reason, hoping that I can find something that we can all enjoy. Yeah. So it's Friday night, yes, as I said, it's Friday night, and some people are elsewhere, I'm sure, but some of you are already here, and this is pretty good. I'm really, really enjoying the fact that you all make it your business to join me tonight for such an important discussion that we are about to have. And we have two wonderful guests. We have one already in waiting. Yes, imagine. And we're hoping that the other will join us pretty soon. So in the meantime, just stay tuned as we try to give you a little music to just warm it up a little here. This is not my music, of course. This is reggae gospel music, and it's from somebody called Gospel Music 24. Just enjoy a little bit of it. All right, so I heard you say, Calvert, you're hearing me loud and clear. I'm happy to hear that. Sharifa, welcome, guys. Thank you so much. At least I know that two people can hear me, which is superb. All right, so everybody can hear me then. Enjoy the music as we get set for a wonderful, informative, and timely program here tonight. All right? Talking about the grace of God, we always want to start with that. It gives us a little purpose and meaning, right? By the way, folks, let me just remind you that today is World Respect Day Life, all right? So it's the 22nd of January, and usually it's World Respect Day Life when there is emphasis being placed on the importance of the life of the human person, you, me, all of us. So I think it's really timely that we are talking about vaccines tonight because it's about preserving the life of the people who exist, those of us who exist in God's world. There are some great people out there in the medical field who are taking the time out to create vaccines, I think. And while a lot of skepticism exists about it, but the fact remains that vaccines have saved lives over the years, and we don't know what this one will do and is already doing. Hopefully our medical specialists will be able to tell us something tonight that will uplift the spirit of those of you who might have some skepticism, and which will probably help you to encourage another person then to get on board and to believe that they too can trust and take the opportunity to get a vaccine. All right, so I'm hoping that our next guest will join us pretty soon. So stay tuned, as I said, as I give you a little music. In the meantime, invite somebody else to come on board, share the live, as much as possible, please. Share the live. Share the live. Yeah, my cry alone. Nice reggae mix right there for all of us. So I kind of like it. It's called gospel reggae. Yeah, and as I said, it's not my music, but I love a good gospel music, and so I decided to start with this tonight. One of those days I'm going to be playing my own music. Trust me on that. I do have one or two, but I think I need to go to the studio. One day God's going to make it possible for me to record some music that I can play for all of you. So yes, I see the numbers are growing. Welcome, welcome, folks. Welcome. I'm not sure if I should wait for my guest, for my other guest. So far we have one here. I don't know if the other one fell asleep. I hope not. I know those guys work very, very hard, yeah? So there's a possibility, but let's hope that he will join us in a quick time. Those guys are very busy, as you can tell. And so I'm hoping that our next doctor will be here with us as soon as possible. So I did tell you that today is World Respect Life Day, yes. Hey, and I see you say you love it, you love the music. Yes, thank you so much, and thanks for sharing. All right, Hanika, welcome from over there in the US. Geraldine John, I see you. I'm thank you for telling me that you are good and loud. We are good and loud that you can hear us. Jacqueline Hughes, welcome as well. All of you folks, those of you on YouTube as well, thank you for joining. If you've not yet subscribed to the channel, go ahead and hit that subscribe button, and you can also hit the little bell so that you can know the next time that C's is on. We're going to have a very informative discussion here tonight. It's very, very informative for you guys, for all of us, really. If we have any kind of trepidations about vaccines, it's an opportunity for us to probably get a bit more educated. And so when we say yes or when we say no, we will do it from an informed perspective. How about that? So tell somebody else whom you know who might be doubting about vaccines as well, or have their own thoughts about it. Ask them to join. Come and join us so that they can be part of what is happening here tonight. I'm going to try to reach my next guest. And as soon as I do, if he gives me the go ahead, then we will go ahead. So let's hope that he is going to join me soon. I might have to ring his phone too, in case if he answers, great. If not, then we're in, we'll see what happens. All right, so I don't want to keep. Okay, awesome. Thank you. We're waiting for you. Thank you. All right, so my doc is getting there. All right, he said he got a message from you, Dr. Shillingford, so he should be on in quick time. All right, guys, so as I was saying, it's Friday night. I hope you guys had a good week, a very productive one. I had a productive one myself. I not too long returned to work, and you can well imagine when you're on vacation and when you return how it feels. First, I was on sick leave, then vacation. So it's kind of weird, going back to work when you had such a restful moment. But it's part of life, and we have to keep moving and doing and creating. So, hi, Jackie. You said you're from Trinidad. Thank you very much. I'm guessing somebody shared that with you. So thank you so much. And you can share that with your friends as well. From Trini, let them know that they are welcome to be part of us tonight. Yes, as soon as our other guest is here, I'm going to just usher them in, and have our discussion to start. In case you're wondering, this is what they look like. So hopefully you can tell when they get here who is who. All right. And so it's Dr. Gregory Vidal and Dr. Shillingford. These two gentlemen have humbly accepted to join us for this very important discussion. I'm hoping that our doctor got the link and he can come in ASAP. ASAP, ASAP, ASAP. Oh no. Okay. So, yeah. All right. So I think you will join us. I think we should go ahead. What do you think, Doc? We should go ahead? Do you think we should go ahead? All right. So, folks, I'm going to start and eventually bring in Dr. Shillingford. Hopefully, yeah, awesome. Thank you. Thanks. Right. So we're going to start. So here it is. Let me say once again, good evening, everyone. And as you know, COVID-19, the COVID-19 vaccine is quite an issue of concern among many people. And as I said, my name is Caesarina Paul. People call me C's. You can call me C's. That's all right. And I host the virtual community dialogue. Tonight, I feature and dialogue with two medical doctors, both who hail from our town, the town of Portsmouth here in the Commonwealth of Dominica. I would like to extend a hearty welcome to Dr. Shillingford, who is already here, and I invite all of you to stay right here with us as we're going to dive straight into our discussion. I'm going to usher in Dr. Shillingford. So hi, Doc. Welcome.
Hello, Caesarina. Thank you for having me.
Thank you for having me. It's an honor. Thank you. You're welcome. I'm grateful. Yes, I think I am grateful. I don't know how you're grateful. I am grateful.
Well, I mean, it's always a pleasure to get the opportunity to educate, to enlighten our community or people, and to impart, knowledge and education on those among us, those we care about.
True, love that. Yes, and I'm happy that you use the term "those we care about" because often some people think that when people like you and Greg and the others, migrate, that you throw stones at the back behind you, as they say, you throw stones behind you and never turn back. But that's not the case with you guys.
You're right about that. I mean, we're still pretty much involved with the community. We're still in touch with, our childhood friends, the people we grew up with, the older folks who essentially raised us. As a matter of fact, this morning I was on the phone with DJ Cooley, discussing a lot of matters. So we always in contact with people.
I like that. That's really wonderful. Anna, yes, I know. I have no doubt. I have seen some of what you guys have been doing. I know that you have a number of philanthropic activities that you all are doing with people like Ashton Revere, when you, Curtis, Greg, all these guys come together. And very quietly, you do a lot of things behind the scenes in the community. And so I know that your hearts are here. I see we have somebody else with us. Let's bring him in. Hey, Doc. Good night. Where are the lights, man? Wait, so we can see your handsome face and your bright smile.
All right, I'm gonna get some.
Yes, that'd be nice. Yeah, I noticed. You notice, hey Doc, you notice what his shirt says? Eat, sleep, and something else. I don't know if it's party or something.
I hope it's be merry.
I hope it's be merry. Possibly. So I'm guessing be merry and party. They go hand in hand. They're pretty close to each other. Right. So hopefully that's what he's encouraging. Eat, sleep, and maybe laugh. Maybe it has to be something positive anyway.
Yep. So you've touched a little bit on our philanthropic work. I mean, in the town.
Yes.
We've been involved with the community in that respect for a long time. There are buildings that have gone up. We are responsible for nobody moved that. We've provided scholarships for students, awards, and a whole plethora of activities that we've been involved with.
Yes, certainly. Yes, and we are very happy, very proud of both you and Greg. Greg, welcome back. You're with us now. Yes, that's a bit better. You might have to put it in another direction, but yeah. Oh, that's much better. Yeah, we can see you now. That's the face we know.
With some beard because I didn't get ready for 5:30.
For 5:30. Okay.
It's all right. Let's get
What's
this.
happening at 5:30?
Well, it's 5:30 my time. I thought we were on at 6:30 my time.
Oh, that's what. Okay.
That's what's going on.
Yeah. Well, we have like about 2 hours ahead of you.
Let's see.
So
I'm trying to
that's
figure
what
out where
it
to put my live.
is.
Are we? We're not live yet, are we?
Yes, yeah.
Yes, we are. Yeah. Yes, we are. And the folks are seeing you and they're waiting to hear what you guys have to say. So right. Allow me to do a quick bio, very short, especially about Dr. Shillingford, because I think a number of the folks might say, I know Greg because he was on with me in October. But for those who do not know, I still want to give a little bit of idea of who you are, your background as far as medically is concerned. And then we'll talk a little bit about the home stuff, the who are you at home, whose child are you, that kind of vibe. So before we delve into the heart of this stuff. Okay, so Dr. Nick Shillingford, and you can see his name here, folks. So Dr. Nick Shillingford, he is and if I'm wrong, please correct me, he's a pediatric pathologist with subspecialty training in gastrointestinal pathology and is on staff in the Department of Pathology at Children's Hospital, Los Angeles. And he's also an assistant professor of pathology at the Keck School of Medicine of the University of South California. He is board certified in anatomic pathology and board eligible in pediatric pathology. Well, don't ask me what this means. I do not know.
So since that was posted some time back, so I've seen.
Yeah, I suspect there's some update. Yes. Okay, awesome. I love that. All right, so he's a member of the Society of the Pediatric Pathology, where he sits on the slide selection subcommittee of the education subcommittee. Is that still on?
No, I've since moved to the Professional Development Committee.
So it's more growth and heights.
Pretty much.
All right, so I'll take my blows for not getting an updated bio on you. I'll take the blows for that.
That's okay.
All right. Okay, good. And then, of course, to give you a little bio about Dr. Greg Vidal, we call him Gregory Vidal. He's not a stranger, as I said, to virtual community dialogue. He has been with us before. In October of last year, we looked at breast cancer and even other cancers for that matter, and had a very interesting discussion. It is one of the most viewed videos on my YouTube channel, by the way. I think people are very interested in health. Yes, we haven't hit the thousands and the millions. I'm not so popular yet, but at least on my channel, it is one of the most viewed videos. So it says a lot about the interests of people and in their health. So yes. So Dr. Gregory Vidal is a medical oncologist at the West Cancer Center and Research Institute, where he specializes in breast cancer. He is a breast cancer researcher. He estimates that 60% of his practice involves seeing patients, 30% involves research, and 10% involves teaching as an associate professor in the Department of Hematology Oncology at the University of Tennessee Health Science Center. His personal experience was the loss of his mother to leukemia in 1997. And that motivated him to pursue a Master of Science degree with research in hemoglobin genetics to get a better understanding of the disease that took his mother. So, of course, there is a lot more that I can possibly read to you all about them, but I'm not going down into this scientific jab. Oh, here we go. Eat, sleep, cure cancer, repeat. I like that. So that's what is on the T-shirt. Yes, that's what is on the T-shirt. Thank you all so much. All right, so we're happy to have you guys, and maybe you can tell the folks a little bit about your background. Greg, I know we've done it before, so you might take a different angle, but Nick, how about you? Can you give the folks a little bit about Zafa Kimunsa? They might be somebody, he's from Portsmouth, who are his people, etc. Give them a little background about you, please.
So yes, as Cs rightly pointed out, I am from Portsmouth. I'm actually from Lago. Usually, when I have to write that down on paper, I tell them I was in parentheses, you know.
Yes.
And from there, I moved to Gotha, just a little bit south of where Serena grew up herself. Um, Later in life, after finishing sixth form college, I moved to Cuba on a vet scholarship. Actually, I was supposed to be an animal doctor. I decided to
Yes.
switch to human medicine while in Cuba. I finished that over there, then I moved to Trinidad and Tobago, where I did internship with the University of the West Indies. Then I followed that by a residency at the State University of New York, then a fellowship at Rhode Island Hospital, and a second one at Boston Children's Hospital. My family in Portsmouth are the Aaron. Cordelia Aaron is my mother. Ashworth Aaron, Aldrich, those are all my uncles. And talking about me, I am Portsmouth.
Okay, we're having a little bit, thank you. We're having a little bit of feedback issues.
Echo.
I
Yeah,
am
I
not
heard that.
sure.
I was wondering.
Yeah. I'm not sure why as yet. I'm trying to figure it out, but
Are
I know
you
when you
hearing it
speak,
from
there's
me
a little bit of.
also?
I'm not sure, but when
Yes, I hear it
Nick,
from
when
both
you
of you.
speak, yeah, when you speak, Nick, there's a little bit of breakup in your speech. So I'm not
Okay.
sure if it's the headset or if it's the internet. Maybe could be that.
Quite possible.
Yeah. So I'm hoping that it. Some folks say they cannot hear too well with feedback. The feedback is terrible. Oh my god. All right. So we have some issues. Let's see. C's. Let's see. Let's see. I'm gonna see if I can find something that's gonna help me to help us to make it easier. So let's see. Just bear with me, guys. I'm here. I'm here. I'm not a technician, but I can see what happens. First of all, let's see. Let's see. Let's see. Okay, can you all talk? Let's see if that'll be better. One. Okay, so my mic is not working anymore, which is interesting.
I hear you well.
You hear me well? Okay, great.
But do I have an echo?
Well, I can hear you clearly. I don't know how they're hearing you now.
Nick, are you hearing me with an echo?
I hear you clearly, Greg. Do you hear me okay?
I still hear you. You have an echo.
Yeah, somebody called me and told me that I have an echo. So let me
I'm not
see if
sure
I
if it's
have
the room.
something open in the back.
Okay. Let's see, guys out there, if you're listening, we want you. Okay, wow. What do you know?
Are you okay?
They say if something has to go wrong, it will go wrong. Lord have mercy. Okay.
I
I did this, I did that. Let's see. Okay, guys, hang on there with me, please, so we can have this rectified. I don't have a technician. It's C's and C's.
You still hearing an echo from me?
Oh, that's a lot better, Nick.
All
What was
right.
that? What did you do?
Well, someone called me and told me
Okay.
to shut down my phone.
Can you hear me?
Oh, you were on your phone too, Nick?
No,
No, I wasn't. It's just sitting there.
Okay.
All right, no, I'm not hearing you guys. That's weird.
We're hearing you.
We heard
And
you.
you can hear me.
Yes, we hear you.
Somebody say no echo.
No, Nick felt his
This
echo.
is weird. Like I don't hear you at all right now. This is so crazy. Like I was hearing you all the time. I didn't do anything much that was different, but now I don't hear anything. So this is very crazy.
Do you hear us now?
Okay, sis. Let's see.
I mean, it's
Can
not.
you talk for me, please? Okay.
Nick, I hear you quite well.
Okay. Okay, good. I can hear you now. Okay. Guys, is it better? Tell me, folks. Problem solved. Somebody say problem solved. So let's hope that it stays that way. Great now. Okay, let's go.
Okay, they want it
Awesome.
surround sound. That's why I'm still.
Okay. I'm still working on my own technicalities here. It's not perfect, so I'm hoping that it gets better. But anyway, let's go. Somebody say echo is back. Jesus. Anyway, let's see how far we can get with this. So we're going to move on to, you were telling us a little bit about your background, Nick. You said that you're a child of, Miss Vanilla. I call her Miss Vanilla Aaron. And so all the Aarons down in Lago just lost your uncle. So accept our sympathy, please.
Thank you.
And we know that in the intro, by the way, I made reference of Greg having lost somebody, his mom, but I do know that you two lost a brother, very close, a brother, Kendall, who was also a doctor. Am I correct?
Yes.
Yes, and lost him to cancer as well. So that too was a break, a very sad situation for you. So I'm trying to get rid of echoes, so bear with me. Echoes. What is this? All right. Let's see if you can hear me now. Can you hear me still, right?
I do hear you. Yes.
Okay. Yes. So I'm hoping they won't get an echo. I'm just praying that there's no echo still. So let's go. Greg, how about you? Can you give the folks a little bit, just remind them who you are? For those who do not know, maybe tell them.
So do you hear an echo from me? I hear an echo back from my voice.
Okay, so yes. I'm getting the thought that I should have a headphone. This is what I'm being told. Let me find a headphone. And this might solve many problems for us. Okay. All right, thanks. Who is giving me that good advice? Dr. Mervyn Wallace. Yes, sir. Thank you. All right, let me see. Let me see if I can get rid of the speaker then.
Do you have a speaker on?
Jesus, did I just...
Sorry, I don't call you C's, I call you Moy.
All right. So, can you talk to me now? Let me see if I can hear you.
I don't... Do you hear me?
Yes, Greg, with no echo.
With no echo, cool. I think we solved our problem. I hope Moy can hear us now.
I can hear you without my headphones, so go right ahead and talk. I'll just, I'll use the computer then.
Thank you, Dr. Wallace. So I'm from Zika. My show met up by the echoes coming back again.
Is it?
Yeah. Did you turn on your speakers up?
Just the volume of the computer, truly. That's all. But
so that's probably why.
The speaker is off.
In the room.
Oh wow, that's. Oh,
yeah.
Man. Okay, go ahead.
Yeah. So, that is measurement Zika by the government schools. My grandmother. Most folks know Ma Morris living by the church in the Catholic Church in Portsmouth. That was my grandaunt. Vinia Green used to work by Mike. That's where most people are associated with. Is my mother. But Vidal, who's contractor in Portsmouth, and Kendra, that's my brother. So that's my family. Father Elvio is my cousin.
Yes.
So that's my jump in the Portsmouth area.
All right, thank you. I don't have my studio headphones. So what if I give you a joke? Like I have a headphone now and it doesn't work. But I want to plug it in so that you don't get any feedback. I'm not sure if it's helping. But as long as you can hear me, then I'm going with this, okay? Can you hear me good?
Yeah, we do.
All right, so let's go ahead with it. Curtis is making fun of you, by the way. I don't know why.
Who?
Curtis Langley.
Who is he making fun of?
Of both gentlemen.
He's just jealous. He likes
I think, yeah, and he says that you guys have glasses. Both of you have glasses.
We try
It
to look
says,
smart.
yes, he's trying to say we're all getting old because I have glasses too, so whatever.
So he's
Okay,
talking about. So you're referring to Curtis Langley, one of my best buddies.
Boca, yes,
We work very closely together on a lot of the non-profit work that we do,
definitely.
including ESS. That's been his thing for a very long
Yes,
time.
yes, yes, indeed. Okay, so I'm hoping that the signal is much better for the folks. Okay, so let's talk about the COVID-19 vaccine. This is why we're here tonight. I know that's why the folks have tuned in, and they have been long waiting. You know, it's 8 o'clock. They're like, when are they gonna start this? You know, so um, Kadis, you need to behave. Oh wow, did you invite somebody, guys? I see a crazy man trying to join us. He's a lawyer.
Who?
Oh no, but he's not even a lawyer. That's weird. There's Alan McLaurin trying to join us there.
And Aline what?
Ali.
Mark Lawrence.
Well, yeah, it's Aline.
Yeah.
Yeah.
Yeah, let him in.
Yeah. Let him in. Oh my goodness. This
Of
is
course. It's
hi
Oh,
Ali.
oh, you know what happened?
Yeah,
Oh,
you shared
sorry.
that link. You
Yeah,
shared
yeah,
that
yeah, yeah,
link.
Hey
yeah.
guys.
Hi,
Yeah.
hi. Ali,
I don't think he
everybody's
wants to
seeing
be
you.
there. I don't think
All
he wants
right.
to be there.
All right.
Hey,
So I'll excuse you. Hi and
what's up, man?
bye.
He got the wrong
One.
link.
Yes. So maybe you guys need to send him the link for the YouTube or the Facebook.
I don't
Send
have it though.
influences. Just ask him to go on influence. Alan, you can just go to influences CEEZ, okay? Influence CEEZ on YouTube or Facebook, and you'll find this live chat. So welcome. Thanks for joining us. All right. So we're going ahead, and Nettie, I see you. Thanks for that. Let's talk about vaccines for a little bit because that's what the folks want to hear about tonight. I want to start by saying that you both have received your your vaccines. I'm not sure if you got both shots, both of you. I know for sure that Greg, you got both shots. As a matter of
I did get both.
I have been, yes, I've been checking you out, so I can see 2 different days, 2 different doctors giving you 2 jabs there, right? So, Nick, how about you? Did you get yours too?
Yes, I did get both.
Okay. And can you tell us, how you felt once you got those the first one maybe and then the second, and how are you feeling today?
So the
Nick,
first
before you go, Nick, which one did you get?
I got Pfizer.
Okay. Me
Pfizer.
too.
Okay. You got
Yes.
Pfizer as well?
Yes.
Okay. All right.
I
So
got
tell
my
us about the Pfizer vaccine then and its impact on both of you.
so I got my first dose on December 23rd, I believe. It was
Okay.
pretty uneventful. Didn't feel anything at all. A little bit of stiffness around the site of the injection, but nothing else. My second dose I got on January 15th.
Okay.
For the first 10 or so hours, everything was fine. I went to bed that night, and I did have to wake up at about 2 in the morning because of a little bit of stiffness around the shoulder joint area and a little bit of chills. The
Okay.
following day, I was a little bit tired, some joint discomfort, and then the following day, which was a Sunday, everything was fine again up till now. It's been a week so far,
Okay.
so I haven't had anything beyond that.
Sorry. So a week you've had after a week you've had both of these.
Yes,
You've had both of these, and it's a week now since you've had both of the vaccines, both of the doses, I should say, doses. What's the term?
both shots of the same vaccine.
Okay, awesome. Easier said. Okay, what about you, Greg? Tell us about your experience.
Yeah, my experience was similar except with less side effects. My first one I did about the 11th, no, the 18th of December, and then the second one I got about the 11th of January.
Okay.
The first one, my body felt like there was something going on. I don't know if it was mental, but it wasn't anything causing me any distress. The next day, I had some pain at the site of the injection, but that
Right.
was it. The second time around, I actually did pretty well. But in anticipation of issues, because I heard, and if you look at the data,
Yes.
public published data on the Pfizer vaccine, you had sort of a higher percentage or risk of chills and body aches with it. So I pre-medicated. I took some Tylenol before,
Ah.
and whether or not that made a difference or not, I felt fine.
How much before receiving the first dose that you pre-medicated yourself? How long before?
So so after the first dose, I didn't take anything, and so 21 days later, I got my second,
Uh-huh.
and about 30 minutes before I got my dose, I took some Tylenol.
And that was only for the second one and not the not the
Only
first.
for the second one, right?
Now, was that something that you were advised to do, or you just thought that you should do it as a doctor?
Actually, the advice is because there's little data, it's really not to pre-medicate,
Yeah.
but you can take medication um, if you have symptoms. The worry is if you take things like NSAIDs that can sort of tamper an immune response, you may um, limit your ability to make the robust antibody that you need.
Yeah.
But things like Tylenol that doesn't have anti-inflammatory properties, I think is a better drug.
Okay.
It has anti-fever properties, but not anti-fever, anti-pain, but not anti-inflammatory properties.
Okay.
Yeah, so our hospital administration had
The echo
forewarned
is
us
bad.
Really? I didn't know
about,
Yeah.
anything different.
yeah, our hospital administration had forewarned us about the possibility of the side effects that I experienced. And one of the things we
What
did,
have you done differently, Nick?
I
I
don't
don't know.
know. I'm hearing him well. I'm not hearing any feedback where he's concerned. I
Oh,
don't.
really?
I'm not hearing any feedback from you. I don't know. Uh, Nettie says she got one shot. Yeah, you got one shot, Nettie. You can probably tell us how you felt. How you felt when you got it, when you got yours. But Nick, you can go ahead. Let's see how it sounds because I didn't do
Yeah,
anything different myself. So
it was good, right? So yeah, I
yeah.
was saying that the hospital forewarned us about the side effects, and we actually rearrange our schedule with that in mind to make sure that we had people available to cover in the event that some of our staff members would be more significantly impacted than others.
Okay.
Most people, when you look at the data, I think it's about maybe about 40% of the population gets some mild symptoms, and majority of people did not get any.
Okay. All right. Well, I've read that there was a situation where with the Moderna version of the vaccine in I think it was in California.
California, yeah.
Yes,
San
where there
Diego.
was right where there was a sort of halt or an advice from the epidemiologist, the chief epidemiologist. I think it's Dr. Pan, who indicated that they should have put a halt on. I think there was about 300,000 doses of the Moderna vaccine because of some allergic reactions that a number of people, about 200 and something people, were well, they came up with that after having received the vaccine. But that was just that isolated case. Do you know anything about that or?
I've read about it, and so there are different types of reactions. There's some delayed reaction, which is sort of what most people get, some fevers, chills later on.
Mm-hmm.
And then there are hypersensitivity reactions or allergic reactions that you get as soon as you get the injection. They were finding that they were getting a lot of the latter hypersensitivity allergic type reaction in a higher percentage of patients getting that, and again, a particular lot. So what you read says, let's halt giving the injection of that particular lot. of injection, not all Moderna. So again, they're all, even if it's a Moderna vaccine, they are created in different batches and potentially in different buildings or different areas or countries. So every country make their own version of the
Version
Moderna.
of Moderna.
So
Okay.
he was saying, let's stop that batch until
Okay.
we figure out what will be in for getting such allergic reactions.
All right. Let's talk a little bit. Let's just backtrack a little. What is a vaccine? Because people are hearing vaccine. What is a vaccine and why vaccines? Any one of you can shoot.
All right. So vaccine is I will start by saying, just because I have had to answer a lot of questions for a lot of people. Vaccine have been absolutely important in the health, wealth of every person who now lives on Earth. Your life wouldn't be the way it is right now if vaccines were not discovered. All right. So
Yes.
let's just all just think about that a little bit. All right.
Mm-hmm.
Now, vaccine is a way that we could prepare your body to fight an infection, a pending infection. So when you get an infection, your body makes particular antibodies to fight and kill the bacteria. Fortunately for us, we are able to create memory antibodies such that they go to sleep. If you get that infection again, it remembers, oh, that's that previous infection, and then makes that antibody to fight it.
Okay.
Vaccines essentially preempt the first infection. So it says, let's make those memory cells
Mm-hmm.
such that when you get your first infection, is already ready. And so
Right.
it can make the antibody to fight the infection. So that's what a vaccine is.
So we can call the
So
vaccine a memory creator.
Of myself or
Of-
antibodies.
right.
so
Yes.
so
Yes.
so how I like to explain it is, and Greg did a very good job at explaining
Mm-hmm.
what a vaccine is and what it does for us. But I would like to add that oftentimes when you get an infection from a
Mm-hmm.
virus or certain bacteria, that infection is what stimulates your immune system to produce antibodies
Right.
against that infection. So you will hear that somebody who had gotten mumps in the past will not get mumps again
Okay.
because they've produced those antibodies. They have cells that have learned to do it, and those cells have memory. So if you are attacked with mumps again, that memory comes out and you produce those antibodies. So I like to see a vaccine as recapitulating that process. You introduce a little portion of that virus or bacteria
Mm-hmm.
to the body, and the body learns to make antibodies against that little protein which is represented on the actual virus or bacterium. And your body develops a memory to be able to help you fight against that bacterium or virus if it ends up, attacking you in the future.
Yeah.
No.
So I want to build on that topic. I also want to talk about the different strategies for vaccination.
Yeah.
And the vaccines that we have is sort of a new strategy. But to add to what Nick was saying, um, not all viruses are able to, the body is able to produce long-lasting antibodies. The influenza, for example, the reason every year you have to make a new vaccine for it is because the virus changes slightly every year, such that the body is seeing a new infection, a new influenza infection,
Yeah.
such that you have to re-vaccinate. For some vaccines, and there's talk about these current vaccines, how you will be protected. You may be protected for 2 years,
Yeah.
3 years. Some vaccines, like the hepatitis vaccine, you may have to get a boost later in life. So again, it's all about trying to create that memory antibody, such that when you get infected again, the body turns it on and you can be protected.
All right. So yes, I also learned that the vaccine will not kick in immediately once you receive it. That someone could actually get someone could contract the disease, that is COVID, for example, and get the vaccine maybe 1 2 days later, and it won't just immediately kick in. It will take a few days, I think, or weeks. Am I correct?
Yeah, so
Before
the body has to make
before the body builds up, yes, that resistance. Yes.
the body has to make antibodies. The process has to move forward to make the antibodies that can protect you. When you look at the graph on the Pfizer vaccine,
Yes.
so the patients who got the infection, got the vaccines, and the patients who did not get the vaccine, the curves were superposed on each other until about 7 to 10 days, and then they started separating, suggesting that 7 to 10 days you haven't produced enough antibodies to protect you. So everybody getting this medicine, great. But once you've produced, because you got the vaccine, once they produce the antibodies, they started getting protected, whereas those who didn't, those who didn't get the vaccine started getting infected, and those who did started getting protected.
Yeah.
So there is a delay.
All right. Before we go, I think folks are complaining about the quality of our sound
I
again.
know. I hear it.
Do you have a headphone, Greg?
I do, and I
Yeah.
have to step away again.
Because I think I'm hearing Nick a lot better. I don't have a headphone, granted, but normally I don't have a headphone in here, and it's fine. So if you get a headphone, it might help.
So the one thing I'd like to add though
Yes.
is that remember that when you hear about the vaccines, you tend to hear about the effectiveness. And you would have heard that the first dose from Pfizer would give you something like a 55% protection.
Yeah.
And with the second dose, it would bring it all the way up to about a 94, 95%. So it means that not everybody will be absolutely protected from the virus.
Okay.
All right, we can assume that 5 out of every 100 people may still get the virus even if they're vaccinated.
Wow. 5 out of 100. About that.
Yeah.
Okay. So because someone is asking who should not take the particular vaccines as well.
So I will start by saying anybody who has had an allergic reaction to the components of that vaccine, because the vaccine is just not the mRNA by itself. You know, there are other things in there, there are lipids, and there are other substances in there as well. So if somebody had a severe allergic reaction to any one of those components, obviously you want them to stay away from the vaccine.
Okay.
There's a little debate about whether the pregnant people should take the vaccine or not. There is no data to suggest that they shouldn't.
Right.
But there haven't been enough pregnant women in the trials to come to the conclusion that the vaccines are absolutely safe for the fetus and the pregnant woman.
So we've actually had some pregnant people who have received the vaccine.
We've had pregnant people in the trial, and we've had pregnant people who have received the vaccine.
Okay.
It is recommended that they see their primary care physician or their obstetrician before they go ahead. But there is no reason to believe that it's unsafe for them.
Okay.
Can you hear me?
Yes, we can hear you. Go ahead. Sorry. If you
Is
want.
it better?
Hopefully, the thing is, what gives a feedback is if there is another gadget or if the gadget is playing back, it will give like an echo Okay, but I don't have anything else playing back here. Right now, your mic is off, Greg, so you can turn it on.
Yeah.
Greg, your mic is off. Your mic is off. So if you can turn it on, but Nick, yours is on. We can see and hear. Okay, Greg, you're good.
Yeah, I tried to power off everything I have here.
Okay, good, awesome. So let's
Me
see.
too.
That will be a bit better for the folks. I'm still working on this technology. All right. So someone is asking, and I would like to ask it for them. What about people with underlying issues? I suppose he or she's saying maybe people who have chronic situations like diabetes, hypertension, maybe cancer, whatever it is.
So I'll take that. Those are
Yeah.
the people who need to get vaccinated.
Yeah.
Those are the people at risk for COVID, for risk for death for COVID. In my practice, and I give people chemotherapy and I treat cancer patients. The recommendation is everybody, um, unless you have, as Nick was saying, an allergic reaction. I still have a feedback.
Okay.
Yeah. It's still there. Yeah, so I mean, as you guys would have known by now, I mean, people with underlying health conditions are much more susceptible to COVID than the rest of the population. So our diabetics, our patients with chronic heart disease, our patients with chronic obstructive pulmonary disease, our obese patients and members of the community, those are the people who are the greatest risk for ICU admission as well as death from COVID-19. So those are the people we want to prioritize, and not forgetting our senior citizens as well, people above 65 years of age.
Yes. So these people, you're saying that I kind of got distracted a little bit because I was trying to fix this song people are still telling me about. Um, sorry.
We lost Nick's
So
echo, and all of a sudden it came back.
yeah, I'm
Yeah.
trying to see if I can hear anything here because all
I
right.
mean, this is the same headphone and mic I use for my lectures and stuff, and I don't
Me
have that
too. Me
problem.
too.
So yours is okay.
I spent days on this computer right there.
Yeah,
So it
me
could
too.
it could be me maybe.
I think it's in the studio.
In the studio. I wish it was a studio. Anyway, let me try it. I'm gonna have to take a pause and run to see if I can get a headphone. If you guys will bear with me, and if the listeners as well will bear with me tonight, um, I can try because right now I have this in and it's not picking up any sound. So if I can mute the sound from the computer, then like echoing back to you. In the meantime, there are some questions. I don't know if any of you is looking at Facebook, and there are some comments that you can maybe run through if you bear with me. I can be back with you very shortly. If
Can
that's
you mute your mic in the meantime? Your
um
computer?
to mute my mic.
Greg, are you seeing the questions?
You want me to
I'm
mute
gonna
my
look.
mic?
I don't have
Yes.
Facebook anymore.
Hold on. Nick, can you hear me?
I hear you loud and clear with no echo.
And with no echo. Okay, let me see if I can get the questions. Um, okay. Can you hear me? I hear you loud. All right. So yes, I can hear the questions. Only person on the mic now. Feel good. All right. Does vaccine protect all strains of this COVID-19 vaccine?
So actually, I just read an article about that, and it seems like both the Pfizer and the Moderna vaccines are protecting against at least the one in the UK for sure.
Yeah.
There is protection against that one.
Yeah, and I just listened to a news report where the recent data suggests that it's protective. The new strains, keep in mind, the new strains that we're talking about, those, as far as we know, make it more infectious, but not more doesn't cause more symptoms necessarily. However, it can cause more mortality if you have a high percentage of infection and you overwhelm the system. In other words, the more people who are likely go to the hospital, the more likely you are people to die. And so in that way, you can have increased mortality with the new strain, but the strain itself does not cause worse symptoms than the one that's already existing.
So it's more infectious, but not necessarily more virulent.
Exactly. Let's see. So let's talk a little bit about the types of vaccines. So
Okay.
there are many strategies. So very early on, and I don't know if you follow history, there is, and I can't remember his name. Vaccines were brought. The history is the idea of vaccines were brought to the U.S. by a slave in Boston.
Yes.
So back in Africa, there was, is it smallpox? I can't remember what the infection was, but there was an infection that was rampaging the world. And back in Africa, it was noted that if you were to take some of the pus or the samples from that infection and give it to somebody who hadn't had the infection, they appeared to be protected. So when that slave came through and was in Boston, and that, I think it's smallpox, that was rampaging that particular area, that slave started talking about it. He spoke to one of the physicians who then advocated and started doing that, and then you had a protection. And so that's how the idea of vaccines came through. What was actually happening there is you were again inoculating people who had not previously been infected with some part of that virus such that your body got prepared for when you get a true infection. And so that's what vaccines are. So one of the strategies for vaccination is you take a piece of that infection
Agent.
virus or bacterial agent, and you let the body see it. So the body creates an antibody to that piece of the molecule. Some vaccines, you actually give live virus to folks, live non-virulent viruses to folks who have not yet seen it, so that your body creates antibodies.
Live
In
but
this,
attenuated.
right, meaning that it is live, but it wouldn't cause you to be ill. Um, in this particular case, with the new strategy, what we've done is, I say we, but the research community has done is, in order for COVID to infect a cell, it has this sort of sticky, almost legs on its surface that has to attach to your body cell in order to infect it. So what we've done is we have created, and each one of those little legs is made from sort of genetic material. So what you've done is you've created in a lab a small piece of genetic material that only makes those legs, and you give it to the body. And so your body then makes those legs without the virus. And because those legs are foreign to your body then creates antibodies towards those legs. So when you get a true infection where the same legs, we've now it carries with it the virus, the body already has the antibody to those legs, and it kills the virus. And so that's the strategy with this one. When you hear the mRNA, what you're actually giving the body is the genetic material to make those little legs or little foot so that your body can then make antibodies towards it. And that's the strategy now.
So and that is particularly important, and it's dear to my heart because of one of my experiences as a physician. So with the attenuated viruses, it can become a problem if the individual's immune system is not solid. So if the patient has a weakened immune system, even that attenuated virus can become a problem and lead to an infection of the individual who receives the vaccine. So the fact that we use in the mRNA to produce a small protein, the spike protein, from that virus without producing the entire virus itself, I think is a very, very big achievement for us. I've seen a patient who actually had a live virus, developed a lymphoma for some other reason, got treated for that lymphoma, and that measles virus created havoc. What we're looking at now is something totally different, where you don't have the organism being inoculated into the body, and there is no chance at all that you're going to have that virus wake up and cause the infection within the individual.
Right. So important. So the symptoms you get when you get the infection is not when you get the vaccination is not the infection, is your body's reaction and your body's production of the antibody. So keep in mind, very, very important. When we get an infection, the fever and all of that stuff that we get, we often think it's the whatever is infected us is what causes us to have that. Most times it's actually your body's reaction to that infection agent that gives you those symptoms. The fever you get, that is sometimes the inflammatory reaction that your body is producing as a result of that infection is what gives you that reaction. In this particular case, the feverish chills that Nick talked about is not because he was getting COVID infection, but it's because his body was now making undergoing an inflammatory process, making antibodies, and that's what he was getting.
Exactly. Moy, are you back? You muted, Moy.
All right, so I suspect I may have to mute myself when you guys are talking, and only talk when I talk. Mute my mic again because it seems
it's night
like
and day, right?
Yeah.
But I'm not hearing anything now. I'm not hearing echo now.
I'm not hearing echo now.
Okay, well, let's hope that it stays, and if it comes back, then I'm going to have to mute myself. But I picked up on what you guys were saying there, and from my reading on this, it definitely said that there will be some basic side effects, which are some of what you all have been mentioning, the whole chills, it's for some people a little fever, and headaches, yes. And so I'm not sure if you got all the questions that the folks were asking there. So
somebody said, what is attenuated, Nick?
So you can think about it in layman's term as you having an organism that is aggressive, but you found a way to tame it down. You know, whether you use a laser beam or you hit it a shot with something, but it's no longer that bad, aggressive agent that's attacking you. It's a little more docile.
Yeah. Okay. And then somebody said for AIDS, like people with AIDS and the immune system for getting attenuated viruses, is that a risk? I guess that's what they're asking.
Yeah, you all were talking a lot about you all were talking about that, like people who are more susceptible to getting sick with COVID, people with AIDS, cancer, etc. I'm not sure that I remember what you advised. Should they receive the vaccine? Does it make it more important for them to take the vaccine than not?
Exactly.
Yes. Again, importantly, what Nick was saying earlier.
Yeah.
And what I was trying to describe, when you get the vaccine, you're not getting live virus. In this particular case, you're getting mRNA that makes a spike protein, a small piece of protein. Right. So those folks can get, anybody who has low immune system, cancer, any of these other comorbid conditions we're talking about, diabetes, hypertension, heart disease, obesity, those are the folks who are most at risk, and those are the folks we need to get. When I say at risk, meaning risk of dying if they get an infection, Those are the folks that we need to start getting infection. In my business, if I am giving a patient chemotherapy, I often don't allow them to get the live virus for the reason Nix was talking before. But the vaccines that are not live, they are allowed to get them.
Okay.
So one other thing I think we need to touch on is the fact that, we have people out there who would tell you that, it's only a small percentage of people who are dying because they're looking at the big numbers. However, the mortality rate is fairly high for COVID. Even so, let's assume that it's still low, and we still don't know what is going to happen to the lungs of those people who survive 10 years from now, 20 years from now. So we're not talking mortality now, but we're talking morbidity. Are those people going to suffer the consequences of their survival from COVID in a decade from now or 2 decades from now in terms of chronic lung injury and, other sequelae of the virus that could really affect their quality of life in the future?
And we've seen that now. We have patients who got COVID in the early months when it first started, who have some sequelae, as you say, meaning some symptoms related to it, who one of my nurse friends, she says she still feels like she's always tired. She don't feel like she can exert herself. And her infection was what, March of last year? So there are long-term side effects.
You mean after she received the vaccine?
No.
She got infected.
The result of the infection, long term.
Okay, wow.
Because there's some proponent out there who say, let us all just allow the virus to go. We get infected, most people will survive. It's not going to be a big deal. There are a few problems with that. One Nick talks about, which is the long-term side effects. The second problem is there are numbers being quoted of the mortality rate being 1%. Yes, that's low. All right. But think about it. There's 300 million people. All right. If 1% of that 300 million dies, that is still a whopping amount of people. And that's not acceptable.
In the US right now, we had 500,000. We have 400 and something thousand going. In California alone, we had about 40,000. That's a lot of people. From one insult, one COVID-19.
Right.
In 1 year.
If we think about
in 1 year.
In 1 year, and if we think about our population here, that is a lot more than us here.
Exactly.
So it is a lot of people.
That's at least 5 times our population.
Yeah.
Another interesting fact is, and if you listen to the people who follow COVID very closely, and listen to some politicians who talk about herd immunity. And for those who don't know what that means, it means that if enough people in the population, and usually we try to get about 70 to 80%, are protected, are vaccinated, then it sort of confers some protection to the few who have not been. All right. So you have to get up there in order to get protection for the few that haven't been vaccinated or infected. And there are some people who propose just let us all get infected. At least if we can get 70% infected, then we'll get herd immunity and we will protect the others. The fact is, there's never been herd immunity as a result of infection. Herd immunity has only been a phenomenon as a result of vaccination. When you vaccinate enough, like when you hear MMR mumps, and you may have measles, we vaccinated enough people that the few that didn't get vaccinated gets protected. But we've never allowed a virus to infect so much people that you can actually get true herd immunity. From it.
And that's a good point. And I mean, going back to the possible long-term effects of COVID-19, I mean, we just think about it as people getting sick. People getting sick now, they cured, what happens after that? But I mean, we have to think about it in the broader sense. Because if COVID-19 does enough damage to the lungs of their victims so that they get, this chronic lung disease later in life, It's also going to impact our healthcare system, right? It's going to impact our workforce. It's going to impact the economy. So it's not just about an individual getting an infection, getting over it, and having his problems. It's going to affect the wider world. It's going to affect the wider community.
It is
In the
affecting
long run,
already, and it's
going
going
to be
to
costly for our healthcare system.
Yeah.
It's just like having a large number of your individuals in your community with diabetes. It becomes a burden to the healthcare system.
Mm-hmm.
And
Yeah.
and especially if it's working age people. So the 40,
Exactly.
50, 60, which are
Productive people.
where your more productive years, if you get infected and sick during those, it affects everybody. It affects the kids, the family. I mean, this is how poverty starts. It definitely impacts finances and family health going forward.
Okay. Let me ask you guys, did you get the question from Dr. Wallace, Mervyn Wallace?
No, what was the question?
What is
Okay,
it?
so he has a few questions actually. One of them, can you get COVID-19 infection from the vaccine? I think you may have answered that already, but you may want to reiterate. Will you need
No,
to
No.
really say that?
No, you
no.
don't get it from the vaccine. As we said, it's only the spike protein you're producing,
Right,
and it's just a small portion of the vaccine itself so that your immune system can identify something of the virus,
right,
but it's not infectious.
right. Now, will you need to re-vaccinate in 1 year? You also touched on that, said there might be the possibility for 2 years. But maybe you want to talk about that again?
So revaccinate in 1 year. So the reason the studies were conducted, and I recently heard an expert talk about Dr. Fauci talking about that, because
Yeah,
some of the proposal right now is to delay the second vaccination in order to make sure everybody gets at least,
the
most
first,
people get one.
yeah,
Um, the studies have only been conducted with 3 week and probably 4 week delay.
yeah.
Uh, the way immunology work, you can assume that 6 weeks, 8 weeks after your first would still give you a robust enough antibody production, immune production, but we still don't know because those have not been studied.
Yeah.
So you still want to stay within that window. We also don't know how durable. I think there was some recent data that suggests that at least 2 years, um, you're protected for at least 2 years once you get vaccinated, or at least have immune production. We don't know much beyond that and how long it will last.
So,
So
so, uh,
people may need to get revaccinated.
Yeah.
so essentially,
Similar,
this is a work
similar
in
to the flu
progress.
shot, I suppose.
Hmm?
Similar to the flu shot, the regular flu shot that is given almost every year.
Right. So I was saying that it's still a work in progress. I mean,
Right.
this thing is evolving fast, and we just don't have all the data. As you guys know, it takes a whole lot longer, not under normal circumstances, to produce a vaccine. This is moving quickly. The other
So,
thing we need to remember too is that the vaccine is not necessarily approved.
right.
It's a temporary. It's really an authorization, an
Mhm.
emergency use authorization.
Right.
The
No,
third
no,
thing
no,
is
no,
that,
no, Doc,
yeah,
before you give the third one, I think these are some of the reasons that people are using to be skeptical about even accepting the vaccine in the first place. The fact that some people say, so long there is cancer, so long there is this, that, why is it we can't get a cure? And all of a sudden, in quick time, there is talk about a vaccine for something that's wiping out people in such a quick time. Like, how could you all come up with, how could the medical professionals come up with a vaccine so quickly?
I want
So
I
for
want to
them,
take that
yes,
because
I know
yes,
you. I
that's
knew
what I
you'd
do.
want it.
I want to take that. First of
yes.
So,
all,
so by the way,
um,
without tripping, Greg, Mervyn,
Yeah.
who is posting the questions here, I think he got the Moderna vaccine,
yeah,
Oh,
so he
okay.
has some experience with the other one.
So he should tell
yeah,
us all. I wish he would come on. We can send him the link and invite him and send him the link.
yeah.
He can come on and share
I
his views if you'd like.
He
Yeah.
already has the link. I may have sent the link to him.
All right.
Okay.
So
All
so
right.
so yes, the deal. We feel like this vaccine came up in short period of time. Actually, the people who the lady, it was a lady and maybe husband and wife, couple who started, or so to speak, invented the mRNA type vaccine, have been working on that for 30 odd years. All right. They've never been able to have it break through. It was because people were skeptical about whether or not that could truly produce vaccine, because vaccines were created in one way for a long time and it's had to break that mold. And it was not until we needed to do something fast in a short period of time that they decided, let's look at that route. And it so happened to be successful. So that has been in the process for a long, long time.
Yeah.
Now, one of the concerns has been the short period of time in clinical trials, such that we generally, a drug goes from 5-10 years before you can get it from start of clinical trials to approval. We've gotten this one down in less than a year.
Yeah.
Are we cutting corners?
So I want to correct one thing though. We keep calling it approval, but it's not really approval.
Oh, yeah.
It's just authorization to use.
Authorization. Yeah.
Authorization to be used in people.
Right.
The fact is, we didn't cut that much corners. We, instead of sequencing, so generally you do a phase in clinical trial, you do an early phase trial, and that phase just tells you about safety of the trial, tolerability, trying to find a dose. Once that is done, you then go into a larger trial, recruiting more patients to look for more efficacy, still looking at safety signal. And then you do a large phase 3, which is usually comparing to either standard of care, sometimes placebo, to see if that drug is better. Then that goes to the FDA. The FDA does its review and then gives approval.
Okay.
What they've done is stack them up instead of waiting for, so you do a phase 1, very small, quickly go into a phase 2, quickly go into phase 3. Another reason why a lot of trials take a long time is recruiting. When I want to do a trial in breast cancer and I need 2,000 patients of a particular type of patients, it takes sometimes 2-3 years to recruit the number that you want. The amount of patients with COVID, you could recruit that patient in a month, 2 months, 3 months, because they are all there. And so you're able to get those results quick, fast, and then see how effective it is. There was a phase 1 done, there was a phase 3 trial done, and we looked at the data. The data was presented, and it is 95% efficacious. Keep in mind, the FDA would have been satisfied with 50% in order to approve it. All right, and we got 95%.
I think 95% is very encouraging. I think it's a good rating, if you ask me. Personally, I have issues with allergies, and so I have been saying, I don't know how this is going to work. This is going to work out. If I were to take the vaccine, how it's going to affect me who get allergies from so many different types of things. So, I mean, what do you say to somebody who has all these complications? I mean, I know you said it earlier about cancer and these other things, but allergies tend to be triggered by inflammation. So what can you say to somebody in my case? There are lots of people like that.
So I mean,
go ahead.
The issue with allergies here is going to be whether or not you have an allergic reaction to the components of the vaccine. So it's not the type of allergy where we're talking about somebody has an asthma attack because they inhale pollen, or somebody has an allergic reaction after they had some shrimp. So that is why both the FDA, the CDC will ask you to declare your allergies to your provider before you get the vaccine. So you have to discuss that with your physician, your primary healthcare and physician, and you have to state that to the people who are going to administer your vaccine as well. I mean, even for us, a lot of us may have some sort of allergy to some component of the vaccine that we don't even know that we have. So one of the things my hospital has been doing is asking the people who get the vaccine to hang around for about 15 minutes. Just sit there. We have physicians who are versed with intubation and that administering epinephrine and that kind of thing on standby right there to make sure that if something happens, at least they can secure your airway, which is what is going to kill you with a severe allergic reaction. So they, people who are very versed on intubating you, securing your airway, they're right there. We haven't had an incident so far, so that's
Mm-hmm.
good.
That's
But
good.
that is
But
why
that,
we're asking people to hang around.
Nick,
All
that
right.
practice is that's standard practice. So anybody who gets the vaccine anywhere, in general, they have you wait 15 to 30 minutes before you leave the area with the health folks.
Now,
So
is there any follow-up with the people who receive the vaccines? Are they able
so
to call in or maybe
yeah,
someone checks up on them at some
so
point?
there's actually an app. They
Uh,
encourage you to download on your phone. Is it called the VSafe?
be safe. That's correct.
Yeah, the VSafe app. And actually, there are people, who will contact you and see how you're doing, send you messages and stuff, little follow up to make sure that all is well.
So let
They
me
also,
ask you, before you continue, Doc, sorry. So you said it's VSafe rather, it's SAFE?
yes,
Okay,
VSAFE.
no, is this only for the US or is it international?
I think it's mainly U.S. It's mainly it's the U.S. And the FDA collecting data,
Okay,
and the health um, and the companies must be collecting data on
data.
how patients are
Okay,
behaving.
okay, all right,
Yeah, how we doing?
all
So
right.
the other
Sorry to
Yeah.
continue. So go
no,
ahead.
no problem.
Um,
The other thing I want us to remember too is that we only seem to be hearing about Moderna and Pfizer, but there
yeah,
are a lot of other, there are a lot of other biomedical companies out there
yeah.
who are working on the vaccine as well. Johnson and Johnson, for example, is working on a
Mhm.
vaccine that may just require one dose.
One
Yes.
dose, and it would
Yeah,
need to be refrigerated. It could
yeah.
be
Oh,
at four. Yeah.
plus
AstraZeneca has one.
you have
AstraZeneca has one
That's
as well, and
You have the Indians. They have. I think they have one or two different types. The Indians as well.
yeah,
Jocelyn, Cuba
China
has
too,
one
Cuba as
actually.
well.
Yeah.
Wow.
Yeah.
Cuba has been very good with
If
vaccines.
I
I mean,
hear
a lot of
Cuba
my
has a
vaccines I
vaccine,
got
I
from
feel
Cuba.
very confident. Sorry.
If Cuba had, say that again.
I said if I hear Cuba has a vaccine, I feel kind of confident about them because I've seen, some of what they've been able to do in the world.
So
Right.
So
I've gotten a lot of Cuban vaccines, of course, because I mean, when we went for school,
that's
I mean,
true.
my meningitis vaccine, my Hep B, all of those I got from Cuba when I came in,
All
and I'm
right.
Yeah.
okay. I'm okay. So
That's good.
yeah,
I heard
Just
on
to,
the BBC today, sorry,
just,
that
just to digress a
the
little,
Cuban vaccine.
just to take a little, just to digress a little, I see Nick, I see that Kenneth Darrow, I think he's one of our ministers, Minister of Health. I
Right.
think, yes,
Hmm.
he is saying hello to you in Spanish. He's saying buenas noches. In
okay. Tell
Spanish.
him
So,
good night for me. Kenneth
yes,
was
yes,
actually my roommate in med school,
that's right. So that's,
so
Oh,
that's
we
good.
go we go way back.
Awesome. He's hailing you up there. A number of your friends, Greg, Sharon St. Clair, is also saying hello to you.
that's
And
my sister.
oh, wow. Okay. Here we go. And Joseph Stronghouse is also giving you all some good encouragement. Shilima, Joseph, and a number of folks are very pleased with what you are sharing here thus far. So thank you for that. So we were talking a little bit about the different types of vaccines out there, and we did say that there are different ones, as you said, in Cuba, in India, England, the UK. I'm sure they have a different one, don't they?
I
From
think
So
what
the UK one
AstraZeneca,
is the AstraZeneca
yeah,
University of Oxford one,
Oxford, yeah,
and that does not require
low
the
temperature.
80 degrees or the 20 degrees freezer.
ah,
That's why it was believed that it would be a better one for international communities.
yes.
Its efficacy is only about 50 to 60%, though, I think.
Yeah,
It has a lower efficacy. Yeah.
Okay.
yeah.
All right.
So
Um,
so one of the advantages of that AstraZeneca virus, I predict, is that
you mean vaccine?
vaccine. So it will be easier transported and distributed in third world countries
Yeah.
That's correct.
because it doesn't require the robust refrigeration that we need for both the Pfizer and the Moderna vaccines.
Mm-hmm.
So I suspect that is one of the vaccines that will make its way to Latin America, Africa, maybe even the Caribbean, and some parts of Southeast Asia.
All
Yeah,
right.
and hopefully the Johnson and Johnson, if it requires only one vaccine, the low refrigeration, and it's more efficacious, hopefully that one can even make its way internationally too.
All right.
All right, so
Yeah.
it's good that there are several options out there. Clearly, we won't have all the data to determine for someone to say, well, I don't want this, I want that. It's like you're going to the store and you can purchase, your choice of a bleach or your choice of a drink. It's not like that. I mean, whatever comes to us, because we don't quite have a choice, and because we also understand and that because we're third world, and there are all these big countries who have the opportunity to grasp as many of those doses as possible, then sometimes it's like take what you get kind of thing. We're hoping that we won't fall into that bracket, but there's a strong possibility that that could happen to small island states like ours in the region.
Well, I'll
So
tell
the
you,
world
Roy,
have
I will tell you in my case, I didn't have a choice either. It was just Pfizer.
Yes,
So even in the first world countries,
yeah,
sometimes we don't necessarily have a choice. My hospital got the Pfizer, and I
yeah.
couldn't say that I don't want that. I'll wait for Moderna. I don't think Moderna ever came here. My
all
wife,
right,
on the
So
other hand, got Moderna. I'm not sure that Pfizer was a choice for her either.
okay.
yeah. No, but importantly, though, I get your point. The World Health Organization, that's a particular focus for them.
Yeah,
That the wealthier countries are not buying up all of the vaccines, such that the lower income countries are not getting it, and that's a focus. I think they're trying to get vaccines slotted
yes.
for
For
low
the
income countries.
Well, just on Sunday gone, our Prime Minister, the Prime Minister of Dominica, Dr. Roosevelt Scarrett, he was speaking with Powerhouse Director, the Director of the Pan American Health Organization, Dr. Carissa Etienne, who's
Dr.
also
Etienne?
yes,
Mhm.
and they were actually addressing that same issue of, ensuring that access can be made to small island states and other parts of the Latin American area. And I was happy to hear her say that she is waiting for her. I'm surprised that she has not gotten the vaccine yet, by the way. But she said she's waiting and she's ready. Like she's just waiting for her to get vaccinated. And then, of course, the Prime Minister of Dominica also indicated that he will take the vaccine, which was a good encouragement for, I'm sure, a number of people who might have been saying, me, I'm not going to take that. Although we still have some people who say, me, I'm not going to take that. But they both lamented, of course, about the need for us to get those vaccines to our region. I think the Prime Minister was saying that maybe we will get those probably by March of 2021. And I think that's an
Pretty soon.
ambitious hope. Don't you think it's an ambitious hope if he says by March?
Right.
Because I'm hearing that other places are talking about 6 months down the line, etc. So I know you don't have the timeline on that, but I'm just sharing that with you, Rennie.
I do want to talk about the folks who say they were never getting the vaccine. I have some
Yeah.
family members who are, and I have some friends who also, talk negatively about vaccine for many reasons. I think it is totally fair that folks who feel like this process happened really quickly,
Yeah.
they've seen some reaction, they want to wait, just from a tolerability perspective. I can understand that. But there are folks out there who have a level of distrust in the system, such that the whole idea of being used as quote unquote guinea pigs, and there's a cultural and history behind that feeling.
Yeah.
Strong
Yeah.
But
feeling.
as a clinical researcher, I want to at least take some time to address some of that. Uh, for one, yes, the Tuskegee Project is the one that we think about first. And actually,
Syphilis.
part of that Tuskegee Project, some of that actually happened in Central America too, and Nicaragua, I think.
Yeah.
Um, uh, but what happened there was folks of color were infected with syphilis and not given appropriate medical attention just to see what would be the long-term outcome, and a lot of people lost their life.
Yeah.
That's a really, really bad time in our history. But what came out of that was in the 1970s, there are a number of um, laws, regulation, both nationally and internationally, that was put into effect to protect patients on clinical trial. I will tell you one of the more difficult things I do is to be nonchalant about trials, to make things up. You have every box need to be ticked, every I need to be dotted before I can put a patient on trial. So, for example, we are guided by the principle that I cannot offer you a trial that you didn't voluntarily make the decision to go on, meaning I have to provide you with information on the trial. You go home, you read it, you discuss it, and then make a decision that you want to do it. The
Mm-hmm.
second part of it is anytime during that trial, if you come on a clinical trial, anytime you say for any reason, I don't want to do this anymore, you're off the trial. No if, ands, or buts. All right.
Fully
The
respected.
second,
Yeah.
yes, the second, another part is I, we, there's a group, and I'm part of the IRB, which is the Investigational Review Board,
Mm-hmm.
where every trial has to be judged based on sort of a benefit slash risk ratio. Every trial has to have a potential benefit in order to be offered to a patient. And there is a group called an IRB made up of professionals, lay people, investigators who sit down and review every trial that's being offered to patients and continue to review those actively as they are going through and make sure that this is safe for patients. And only then can a patient go on the trial. So there are lots and lots of protections.
Yeah.
Um,
This
are
is.
there people out there going crazy and trying to buck those? Probably, but that's very, very rare, and they all get caught
To
and
add
get
to
shut
add
down.
to add to Greg's point, I'm just
Mhm.
Tuesday gone. I submitted an IRB request for a research project where my subjects are actually medical students. In my research project, they're actually going to be doing an exam. I'm not giving them any medication, any injection, or anything. But I still had to go through that same rigorous process that
Mm.
Greg is talking about
Right.
before I get approval. And I'm not introducing anything new to the subjects. So it's not as simple everybody just doing what they want thing. This thing, to get these
Highly
drugs to
regulated.
market, to proceed with these research projects, the researchers have to go through a very rigorous and screening process before they get approval to do what they want to do.
And importantly,
one could argue and say, well, you do have those who are unethical and who would probably try to, as you say, cut corners and or take shortcuts and may have
but
money. Yeah.
that's
Mhm.
why the decision is not up to the physician or the researcher.
Right.
There are groups that are independent of the researcher who review those things. Importantly, pharmaceutical companies themselves who own the drugs and sponsor the drugs, they themselves cannot conduct the trials.
Yeah.
That's why there are people like me. They have the drug, they sponsor it, but only physicians independent of the pharmaceutical companies can conduct the trial. I do want to make also mention about folks of color and clinical trials, not just COVID. The fact remains, especially in oncology clinical trial, in the United States, despite being 30, maybe 15 to 20% of the population of the United States, only about 5% of folks of color participate in clinical trials. All right?
With
You may
reason.
say,
The
Some people
trust.
say, some people may
Trust.
say good, but here's the issue.
Mm-hmm.
The
The
benefit.
issue is when the drugs get approved,
Yeah.
guess who uses it? All right. When diabetes is one of the
Yeah.
diseases that affect the folks of color the most,
Oh, yeah.
all right, you are going to use the drug when you don't participate in the trial. What we don't know is it effective in you, in
Right.
people like you? Is it more toxic in people like you?
Yeah.
Are there any other adverse? We don't know that, but you end up using the drug. All right. So that's what's happening. We have people who don't participate in the trial, but still end up using the drug and expect to get very similar efficacy. We hope that they get similar efficacy. Right now, there's a big push to sort of increase sort of minority population in trials because we do understand people are different and we do understand you can see difference in efficacy, difference in tolerability and toxicity on trials. And so it's really not a good thing that folks of color don't participate
It's
in
going
trials.
to take it sounds like a mountain to climb to actually convince people of color to get involved in trials because, as you said, of the trust factor and the
Yeah.
historical reasons for that. Of course, there are genuine reasons why people would be very skeptical about it. We've heard of the conspiracy, they call them the conspiracy theorists out there who talk about people wanting to get into your DNA, so they're giving you
Yeah.
that vaccine to control you, to control the brain of the black man or the black people, and all
Yeah.
sorts of things that surrounding this COVID-19 virus and the vaccine. So I'm happy that you guys are helping to debunk some of that tonight, really.
So that is really a problem, and you would imagine that we as physicians we get phone calls from our friends all the time and colleagues about that.
Yeah.
Just maybe 2 weeks ago, I had a call from a friend of mine, from Collyho, who told me, you know what, he's headed to Home Depot right now because he understands that the 5G is in the virus.
Here we go.
So he's going to Home Depot. He said the virus is not a problem, it's the 5G. So he's going to Home Depot to get a mask that has a copper filter in there
Ah,
to keep the 5G out. And I'm trying my best to educate him, to explain to him that this cannot be possible, but it's a mountain to climb. And you imagine we have people call us with that issue in the morning, another one calls us at midday. So we spend a lot of time, trying to
to debunk.
educate people and to get rid of the ignorance around the virus and the vaccine. But
Yeah.
it's really a mountain we're trying to climb. It's really a challenge.
Yeah.
Yeah,
But
and you can't really blame people because a lot of people don't really know the field enough to discern what is
exactly.
real and true from what is not. And you read all of
Mhm.
this stuff on social media, and it's hard. And some people are just that way
Yeah,
to believe those
they're prone.
stories. And it's hard to break through once you've gotten that in your head. Um, for some reason, Bill Gates is a villain.
Yeah,
Yeah.
I don't understand that.
Yeah.
I
I
had
don't.
had a discussion with my brother, with one of my brothers, on my dad's side. And
Yes.
what Bill Gates is trying to do is really something that's going to benefit our people. The interest in malaria, for example. Nobody has come up with a vaccine for malaria, and that is what is killing a number of our sub-Saharan African, I'm colleagues back there in Africa. So it's really disheartening to see people attack Bill and Melinda Gates when they put in so much of their time and resources into something that's only going to benefit us.
The
So
guy has spent all of his billions of dollars. Nobody else has done that.
Yeah,
And put it in a foundation that is spent mainly trying to in the African continent.
yeah.
Um, and I don't understand where those things that's coming from.
I
It's about.
mean,
I heard they're trying to control the black folks. I
yeah.
don't know.
That's the same kind of pushback Bill Clinton got in sub-Saharan Africa when he was trying to eradicate the Guinea worm, which was really causing significant morbidity in that population there. And it was a simple issue of just boiling the water. and there's so much pushback on that.
So
But
it is
the other
clear
problem
that,
I want to bring up
yeah.
before we move on is the fact that we have medical professionals
Mm-hmm.
who are propagating. I saw a doctor in Dominica
Yeah.
with a post on Facebook describing how people are going to mutate after they take the vaccine, and that is this happening. Somebody in
Wow.
the medical field who spent years in medical school, who understands those things, propagating that kind of ignorance. And people look up to people like that. You're a
Yeah.
physician in the community. people
Mm-hmm.
people look up to you. What you say is gold. You have to be a little more responsible with what you put out there and what you feed the people. You have that responsibility to the people. I saw a video recently of a Caribbean physician who is talking about the fact that an RNA virus, COVID is an RNA virus. It's not a DNA virus like hepatitis B. He is stating that the RNA viruses are so labile that a vaccine will never work for a virus like that.
I
Now
saw
that
that
just
post.
took
That
me back.
that was a Jamaican guy.
That took me straight back to my training at Boston Children's Hospital, because at Boston Children's there is a basement down there where they have 5 iron lungs that are now obsolete. We don't need those iron lungs anymore. Why? Because of the polio vaccine. Those were used to take care of polio patients who had respiratory compromise because of the effects of polio on the nervous system. Now
Mm-hmm.
we don't need those anymore in the US because the polio vaccine, and polio is an enterovirus, so it's an RNA virus, has eradicated polio pretty much in the US. The same for measles. Measles is an RNA virus. Mumps as well. So I don't know how ignorant a physician can get to make a whole video dedicated to trying to debunk an RNA virus and its effectiveness. This
So
is what kills me.
so right now you're saying that there is need for a greater level of discourse, not even just among
Yes,
the regular lay people like me, but even the medical
healthcare
professionals
provider.
throughout the world. Because one of the
Yeah,
things that is in my mind, and I'm wondering, and I'm guessing that some of that is already happening, but I'm hoping and I'm wondering whether there will be or there is some level of unity or unism in developing that very vaccine. Since we have all these different types all over the world, people are coming up with different, even in the US, as you said, you have Pfizer, you have Moderna, you have Johnson and Johnson developing its own, etc. I mean, the communication, the need for that level of dialogue and sharing of data in terms of the impact of the vaccine as time goes by, so that there can be a better tweaking. As someone asked the question earlier, like, will there be continuous tweaking to make the vaccine safer? I want to think it's a yes to that, but you guys
I,
can speak to that.
so the answer to that is yes. What happens and what continues to happen in the medical field and the scientific field is um, those we do have large conferences and folks
Yeah.
present their data over and
right.
over and over. They're showing the reason the vaccine was able to be created so quickly. It's because once in China, once they got the sequence of the virus, they made that available, and very quickly folks were able to start. That's why the Moderna vaccine, you hear about this um, black girl in the NIH who was working on that. The reason they were able to start creating that very early, it's because they were starting to create a virus for Ebola very similarly. And once they got the sequence that was made known and put out there by researchers who had it before, they were able to then use that knowledge that they had from creating an Ebola virus Ebola vaccine, to then target making a COVID vaccine. And so we could get there faster than we've ever had.
So you would remember, sees that I mentioned the VSafe app, right? So one of the things they're
Yeah.
using that for is to collect data. And that data is not just
Mhm.
going to sit there. They're going to analyze that data and try to see if they can determine you know, whether or not they're seeing certain patterns in there, you know, in the response, you know, that the individuals are giving. And that is going to serve to help them determine, you know, how better that product can be. You know, what
Yeah.
can they do to further develop? They don't just stop there. Now that we're getting the vaccine, Pfizer and Moderna are not just sitting back with their hands crossed.
Right.
You know, they're monitoring stuff, they're studying the data, they're doing further research.
That is good. That is very important. That is very, and I'm happy to note, I mean, the usage of technology, even to get that data rather quickly. I can imagine how rapidly you're getting that data, they're getting that data, because if people sign up to this app and quickly start sharing what is happening to them, how it's impacting them, etc. I mean, I can imagine how quickly the tweaking and the enhancement of those particular vaccines can happen. So I think there is a level of hope when I hear that.
So the one
Yeah,
thing
and
I want to add
importantly
though,
though too, sorry, what importantly to a lot of those companies like Pfizer, for example, has vouched really to create this not to make profit. So they're selling those or giving away those vaccine um, really at cost. They go to the government and they say, "This is how much it's cost me to make it." The government buy those vaccines. They're really, a lot of them are not in it for profits. I don't know about the smaller companies, but the larger ones who started with the vaccine, that's not a profit making, at least not through the vaccine. Um,
so
uh,
the other thing I'd like to add though is we want to give the praise to Pfizer and Moderna and you know those companies, the biomedical companies that produce the vaccine. We need not forget all the other companies that are involved with logistics
yeah,
and you know Amazon, the Palantir, you know those companies that bring the vaccines to your doorsteps and make it work in an efficient manner. You know, have the trucks coordinated, you know, to get to California from Michigan, to get to
Yeah.
Florida from Ohio, and so it's not just those vaccine producing companies. You know, it takes
Mm-hmm.
really a system of
Yeah.
different industries to really
Mm-hmm.
get the vaccines, you know, to the individuals who need it. And you
Mm-hmm.
know the airlines and you know all those you know different areas are within the economy that makes this happen. The
Yes.
information you know sharing and that kind of thing, it's really
So
a big deal.
commendations to all the players in the field, all the people who make this possible, and we're hoping that kind of the distribution can increase as soon as possible, because I have been following the news, and according to CNN, there was not so much of a plan for distribution left for the new president. So
Yeah, well
it's
I'm
important
not
that
surprised.
yeah, it's important that happens rather quickly, so it can reach the people who need it most. Just
And
to take a few questions. Yeah,
we have to
sorry, go
thank our
ahead.
volunteers too though.
Oh, who?
Those who took the risk to
to participate
volunteer
in the
for those
trial.
trials, the
Yes,
thousands
Yeah,
of people.
yes. I was very happy to see the person who received the vaccine, the first person was a black woman, call it.
Yeah, yeah,
I think her name is Sandra. She's a nurse,
yes,
or
yes.
Chandra,
In
something
New
like
Jersey,
this.
I think. Yeah.
Yes,
yeah,
and
for
I
the
was very happy
questionnaire.
to see her days after she received it. She was featured on that in that I think it was a concert that was held the night of the inauguration. She was one of
Yeah.
the
Oh,
persons
really?
who were
Okay.
featured. Yes, so I felt like that was a bit of encouragement for people out there. She took it, and hey, she's alive. Look at her; she looks well. So I'm
Yeah.
hoping that is also a sense of encouragement for people like me and the rest of us out there who are still thinking about whether we're going to accept yes, no, to take the
So
vaccine. Yeah.
one of my rationales behind whether or not I should take that vaccine is the data.
Yes.
When I look out there and I see that 3% of people are dying from COVID, and I see people looking like me, my age, my race, my
Yeah.
sex, who are dying from COVID, when I see that it reached, close to home where somebody from Coliho who's not that much older than I am died from
Mm-hmm.
COVID, and I
Right.
look at the risk of taking the vaccine at the time, it was, Bell's palsy was one of the most serious side effects of the vaccine. Even so, that was temporary. It
Yes.
was a transient thing. It wasn't permanent at all. And even with that, I could see myself living with Bell's palsy for the rest of my life. However,
And Bell's
people like
palsy is where one side of your face,
Yeah.
one side of your
essentially
face
facial
just
droop.
droops, you know?
Yeah. Yes.
And, you know, it makes all the sense in the world that I get vaccinated. You know what I mean? So many people are dying out there. We at 400 and something thousand in California,
Yeah.
you
Yeah.
know?
Yeah.
So,
And so importantly too, on the Pfizer, at least the Pfizer study, remember
Yeah.
I talked about only 5% of folks of color participated in trial. Actually, on the Pfizer study, 40% of the people who participated on that trial were of color, be it Hispanic and or
African
Black.
American.
Yeah. So we have a lot of very good data to suggest
Yeah.
that it's effective and safe
That's good.
in
So,
folks that look like me and you.
Yeah.
and that goes back to Greg's previous point about black people enrolling in those trials. We need to remember that if we as black people don't give ourselves an opportunity to participate in research,
Yeah.
we're never going to know if that drug in question is effective in all people or if it produces significant side effects in all people. So it's really important that we really are part of those trials. Otherwise, we just don't know.
All right. Well, I'm happy that you guys emphasize that tonight. The time is quickly running. We are at almost 2 hours of being online here. We started a little after 7:30. We it's about 9:22 now, and in my time that is maybe I don't know what's your time, but it's
For me,
722 mine.
it's
seven.
5:22 for me.
Quite early. You guys are just starting your evening, so you're not even worried. You're like,
I'm still at work.
oh yeah, we go. And Greg is like, well, the night is young, so but
Yeah.
it's 9:22 here, and I know we have a lot more that maybe people would even like to ask for that matter. Someone says every 20 seconds one person dies from COVID. I saw one. I think I was watching the news, CNN, and they said every 6 minutes somebody dies in Los Angeles. That was probably a few days ago from
Well,
COVID.
well, to be honest with you,
Yeah.
a few months ago, one of the senior hepatologists here at the hospital, on a Tuesday or so, he poked his head into my office and he said,
Hmm.
"Oh man, you have a nice office. I'm jealous." And on Sunday, I get an email from the hospital and the man is dead.
Oh my gosh.
Yeah,
From
that
COVID.
from COVID. So I mean, that got me thinking. I mean,
That's serious. Yeah.
it's out of this world type of experience here. A
Yeah,
man
we
I've
do.
known
Yeah.
for my 6 years here,
Yeah.
you know, vibrant, active, and just like that, he's gone. See him on a Tuesday and on a Sunday, he's gone.
Yeah.
So it's really dramatic.
So there are people around you that you see, and that's the thing. I mean, we are here, we have very few cases, although one is too much for us, small population. But in comparison to even some of our sister islands, we are still really low within the numbers. And but we think about people like you all out there in the heart of the thing. I mean, my own sister was diagnosed with COVID, and
Yeah,
she
I
has
saw
been
that.
home. Yeah, thankfully they've been able to recover. So I mean, there are people that we know, people that we see, we've talked to before, and now we're
Yeah,
hearing, and you guys know a lot of them. So to hear you to share those stories and to say to us, look, I took the vaccine, and it's important that you take the vaccine. It's very encouraging and enlightening to me personally, and I hope to all the folks out there listening. I see Sharon Liquent, Sharon Dupin Liquent is on. She's saying, hi, Nick, this is very informative. She says we'll be opening our public vaccine clinic next week. She's somewhere in the US as well.
she's in
But I know
Canada.
Yes.
that this week or last week she received the vaccine. I think I saw
Yeah,
a
I saw
photo.
the picture.
Yeah,
Yeah.
Yeah,
But
yeah. So it's good.
boy,
Yeah, go ahead.
Steve, one of the things I wanted to say is
Yeah,
we've seen looking through the media that leadership matters.
yeah,
yeah,
We see how in the US and other parts of larger countries in the world, the difference in infection rate based on leadership.
yeah.
Um, in Dominica, again, not trying to make this political, but Dominica has fared very, very well.
Yes.
And part of it is due in part to your leaders taking this seriously and doing what they needed to do to protect the country.
Very
And
early,
you,
very
you
early.
have to you have to give kudos to folks when they've done something well.
Yes.
And folks have been very lucky in Dominica because yes, your leaders have done very well.
Yeah, I think our healthcare professionals as well. I'm on a little chat with the group, and it has been a very positive dialogue on there where members of the medical board and the medical association and the physicians association, they tend to share information and really work with each other in enlightening the other healthcare professionals around COVID and the measures and the
Yeah.
new approaches that have come up and what we do next and what we do in that situation. I must give them a lot of credit for what they have done in Dominica and what they've been able to accomplish. We haven't had a death, and we've had a few cases,
Yeah.
but we've done pretty well compared to a lot of these first world countries out there, where I think we've outdone them, with respects of handling, COVID-19 and quarantine and prevention and,
True.
and those very very good measures
Yeah. Just
to
just to
make this thing.
Just to tell folks who may be wondering what are the figures we're referring to, as of a Monday, January 18th, 2021, January 18th, that was, we had nine total active cases. We had 0 total COVID-related deaths. Total recovered 104. Total confirmed COVID-19 cases 113, 113. Number of contacts under investigation at that time was 0. Number in government COVID-19 quarantine was 51. Number of contacts cleared was 868. Number of contacts identified, 868. Number of persons tested was 8,498. And number of negative results was 8,385. And that was as of 18th of January this year. We're talking about just a few days ago. Yes. So
I mean, do you remember that first case that came to Dominica where that gentleman went? I can't remember what village it was.
in the eastern
And you
part
had about
eastern part of the
7 or
island.
9. You had 7 or 9 cases related to just that one person.
Just one person.
Imagine if that wasn't managed appropriately.
Yes. Yes.
How quickly that could have spread through the country.
Yes.
Imagine if 10 people needed to get intubated in Dominica, Nick.
Yeah.
I mean, do we even have 10 ventilators?
Yeah. That would have been a disaster.
Yeah. And that is why the health authorities are constantly reminding us here to not take things for granted, to remain vigilant. Please. And also discouraging the people who try to come in by back door. They put us at risk. They put their families and loved ones at risk. And so asking us to be vigilant, respect the authorities. If you want to come in, save your money, come in the legal way, go through the quarantine, so we can all be safe together. And I know that there's a possibility that folks are getting tired of wearing the masks. When you go to this, to that, you have to put it on, sanitizing and being so cautious. But in reality, it becomes the norm. It's now the norm, as I said, a new normal. And so we have to stay on it. We have to keep at it because we can see the results. We can see the results. How our authorities, our leaders, the Ministry of Health, the minister, and all the essential workers, have these people not done their part to pull things in order as quickly as possible, we would have been in trouble. And so we have to truly thank them, commend them, and continue, Dominicans, continue to do the necessary things to keep Dominica and the rest of the region, for that matter, safe and COVID-free as much as possible, so we can help the rest of the world. Yeah.
So one of the things I would like to see come out of this, COVID-19, one of the things that has happened is that a lot of us out there in the diaspora have been able to collaborate and work with, the physicians in Dominica, share information and that kind of thing. And what I'd like to see though in the post-COVID era is, more collaboration between our healthcare profession. And it's a thing my good friend Shay Avril always brings up, is that we're not working with the resources we have out there. We have a lot of professionals out
That
there,
is
whether it's
true.
healthcare, engineering, agriculture. If we could form a little network
Yeah.
whereby we can consult with each other. I mean, Greg knows that I call him all the time when I have cases around
Yeah.
oncology and I need some advice as to what sort of medication we should be thinking about. If we could do that on a larger scale, involving the healthcare system back home, maybe even with a few of us dedicating a week of our time to going back home, to work with our physicians in the hospital, depending on our various expertise. That to me would be a very productive and very 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 good initiative for the
Yeah, well, I'm happy
country.
So,
to hear that. I'm happy to hear that, and
so
I'm
Nick,
hoping that we can
Yes.
start from here. We can start from here. I think. I mean, I'm happy to hear that you guys liaise. I know that you are in very close contact with Dr. Wallace as well, Moving Wallace. We also have another Wallace, Nadia Wallace, who is a psychologist. So we have lots of
We
doctors,
exchanged,
not just oncology.
Nadia and I exchanged text yesterday.
That's right.
yeah.
We have
So Nick,
Jovid over there in
Trinidad.
Trinidad. Yes, and all these
oh,
people.
that's where he is.
Yeah,
Yeah.
So Nick, I mean, I sent an email to you. We talked about this.
yeah, I
There
saw
is
it.
an initiative that's being, at least being thought of currently in Dominica, because I got an email from at least the health board, a member of the health board, about collecting names of Dominica's physicians, their specialty and their contact,
Yeah,
Excellent.
um, to create and do such that very thing. And so as a result, because we have open ear, um, and I would help like you to help me with that. Anybody who knows Dominican-born physicians out there, can you send me their names, contacts, and specialties
right.
so
So
that
I'll
we
do that.
that
I'll do
list
that.
together?
So,
Even more and anybody else
Yeah,
who's on there,
send
my
it to
email
me.
address.
I will send the information, all to Greg, to Nick, and they will get it to the necessary authorities. I mean, you guys know that a new hospital is being the hospital is being almost, well, I don't want to say new, but it's new. It's being turned into new. As a matter of fact, I mean, new name, new parts, new. If you see what has already been laid down, it's beyond, what we would envision for a quote unquote little island, right?
yeah,
And of course, we have a number of new health centers being built throughout the island right now, and of course, the new Margaret Hospital. And so, all these are going to require, as you all say, the specialties of the various various health aspects of humanity. And so, people like you all in your different special areas or specialties will definitely need to, if not come home, but at least to lend the support and the guidance. What is it is going to be needed and so on. So I think maybe that's where that is coming from, Greg, when they're asking for those kinds of data. So I'm happy to know that they're reaching out already.
so
So definitely, that's the whole idea. Go
yeah,
ahead.
that's something I'm very passionate about. I want us to give back, and I'm pretty sure there are thousands of professionals out there in the diaspora who would love to give back to their community in a meaningful way. And
Yeah.
at one point in my career, I was the person responsible for I'm reviewing and diagnosing a lot of the malignancies that were coming from children in Latin America,
Mm-hmm.
Guatemala, Costa Rica. And one of the reasons why those would come to me is because I was the only Spanish speaking, junior person in my department at the time. It was very good for me in terms of learning and getting the experience, but also I was doing a service for people out there that I could have also been doing for my people back home. You know what I
Okay.
mean?
Mm-hmm.
So I think it would be a good idea to really tighten the relationship between our physicians at home, our healthcare system at home, and our physicians out there. And I know
Yeah.
a lot of physicians in the US, in the UK, New Zealand, Australia would be very happy to give back to our people.
Right. I
Yeah,
see Good Living is already extending some names, like Swinburne Augustine. I think that's the name that he's extending
Yeah,
there.
somebody in Florida.
Right. He said we should contact you guys. Should contact this gentleman. He's in depth on the level of COVID. I suppose he has information. And so, all of you out there, our listeners, thank you all so much for staying with us. I know it's late, and some of you are still here. It's a Friday night, so I really want to thank you all and commend you all. But I also want to ask you to share that information that Dr. Shillingford and Dr. Vidal are sharing with us tonight. That they are trying to see how they can create and contribute towards the creation of a network of health professionals throughout the world, throughout wherever they are, and they're Dominicans. That there is that link. If you can't get to them directly, you can send the information to me. I will forward it to them so that they can create and help to create a database. It's going to benefit all of us in the long run. So we're very happy that some of you are already sharing that information. If you have those information like Good Living, if you have his contact information, share that with us. We can send it to Greg and Nick as well. All right, gentlemen, doctors, my friends, I am so happy that you all could share so much with us. Obviously, this is not exhausted. We cannot exhaust this subject that we're discussing tonight. There is so much more that can be said, that needs to be said, but I think that you have set a very solid foundation for a lot of the skeptics out there. And now you've given us reasons to go out and research more. But before you give your closing remarks, each of you, I would want to ask you, or maybe in your closing remark, you can include it, where would you encourage lay people like us to get the genuine health information that we should take at face value when we read it? Because there are all sorts of sources out there. Clearly, anybody can sit on the computer, create a Wikipedia page or whatever, and just put out stuff. So, in your closing remarks, I would want for you to share that as well. Any one of you can go first.
You want me? I'll go first.
Yeah, go ahead.
So, again, Moy, thank you for. I keep calling you Moy because that's.
Hey, that's fine. That's fine. Listen, the people who call me Moy, it means so much to me because I know that these people know me from way back when. And so it says a lot. So there is no harm in it. I am good with Moy.
All right, cool. So again, really, really thank you for having this conversation. I think this conversation was really needed. I hope a lot of people get to see it and to tell their friends about it. I hope we also address a lot of your questions, although we hadn't taken very much questions. But I think in our conversation, we may address a lot of the things that you questions that you've had. Importantly, I think what I want you to take away from this is COVID is very serious. It is deadly. It may not be deadly to the average person, but people who are most at risk are dying from this disease, and it is not going to just go away. We can't just wish it away. We have to take particular action, both in our personal life and our health life. Social distancing, masking is important. It prevents the spread of the disease. Vaccination, again, vaccination is preventative.
Yeah.
If we can vaccinate enough of our population, we can potentially eradicate this. All right. There are obvious concerns about the rapid pace of these coming in to use, and I understand that. I hope by having two physicians who themselves have had the vaccine and have done well, who know enough about it and still decide to take it, will let you feel a little bit more comfortable that this is safe. As far as getting where you can get information on, there really isn't one particular site that has all of the information, but in general, information that you get about COVID from sites like CNN, the New York Times does a lot of very good write-up on COVID. I would say your source of information, make sure you are familiar with when you read a an excerpt on Facebook or on social media, that the source is someone that you recognize and you can trust. And if you don't recognize it or trust it, it's very easy. Google them. All right. And then you can figure out for yourself and then do your own research. If they say something that is a little bit against or out of what you believe, do a little bit more research about it before you accept it. And again, Moy, really, really thank you. Um, I will give my email address. It's gregoryvidal@gmail.com. I am really interested in collecting the names of medical professionals, their contact, and their of Dominican origin, and their contact and specialties. Again, it's gregoryvidal@gmail.com, so that we can, as Nick was talking about, put those together to create that database that we so need. Thank you.
So Momoy, I'd like to thank you for having me on here. It's always nice to be able to connect with, the community that created us, really, the community that grew us, that raised us,
Indeed.
give back, in terms of, imparting knowledge, imparting guidance, sharing, with our community. It's always a pleasure to do that. That is what we're about.
Yeah.
Um, I want to encourage the listeners to at least put a little thought into, the vaccine and COVID virus itself, compare the implications of either of them, look at the worst case scenario, the worst outcome you envision with COVID-19 and the worst outcome you envision with the COVID vaccine. Take a look at the rate of adverse or bad effects secondary to COVID and compare that rate to what you see and hear about and read about with the COVID vaccine, and determine for yourself whether it makes any sense at all to risk getting COVID against getting the vaccine to protect yourself against COVID. And when you do that in depth analysis, you will realize that it does make some sense to at least consider the possibility of being vaccinated, especially for those people out there who have premorbid conditions, things like diabetes, hypertension, lung disease, immunocompromised states, people who are on cancer chemotherapy. Really give it some sort of consideration so that when it comes around, you can make an informed decision as to whether or not you think that this is something that is good for you. I do believe that it is. The other thing I would like to encourage you to do is, when you go out there to seek information or when information comes your way, ask yourself if you think that that person who is relaying the information is qualified enough, has enough experience, knows what it's talking about, enough to influence you to decide whether or not you want to take the vaccine or you want to go face COVID-19 on your own. I mean, when I go back to Dr. Fauci, I remember the Harrison's Internal Medicine book, which is one of the Bibles of medicine. Anybody who goes through medicine anywhere in the world, in any language, has a copy or has had a copy of the Harrison's. And Dr. Fauci is one of the principal authors of that book. You'll see his name on the cover. So that's not a man who's just popped out of nowhere. That's a man who has vast experience in the medical field. He understands viruses, he understands virology, and it's somebody I think we should trust. He's the expert. Why should we trust a man from Jamaica who claims to be a bush doctor, a bush physician, who tells us that the vaccine is not good over somebody like Fauci who has experience with viruses and vaccines? So our source of information is important. And, we have to give that serious consideration when we make those life-changing decisions, because they are really life-changing. Parents are dying and kids are becoming orphans. We're losing our siblings. We're losing our doctors, our nurses in the community. So these are really serious and life-changing implications with this COVID-19. So put the thought into it, approach it from a critical thinking point of view, and ask yourself whether or not it makes sense to not vaccinate and risk getting the vaccine, especially if you have a pre-morbid condition. So that's what I'd like to leave with our audience. I'm not telling you what to do, but
Yes.
I'm asking you to give it some consideration, give it some thought, and
Mhm.
do some research for yourself if you're not satisfied with what you know. Dig into it, go to the CDC website, read up on it. It's all there for you. And, inform yourself. Knowledge is power
Yeah.
at the end of the day.
Yeah.
Knowledge is power.
Oh, so yeah, so the CDC website, that's definitely a place that you can go in to get information.
Yes,
Agreed.
I was actually going to share that because I have to do my own reading prior to meeting with you guys tonight. And of course, that was one of the places that I went and got some very solid information about the various types of vaccines out there. So I want to thank you all on behalf of all the viewers, all the people who have joined us tonight on YouTube and on Facebook. I truly want to thank you and honor you, gentlemen, just for making yourselves available in your busy schedules. I mean, Nick is still at work, as he said earlier, and I know Greg always has something else that he has to do. He's always busy, even if you feel he's in a t-shirt, but I'm sure he's doing some good stuff in any case. So I want to thank you all for making it your business to share with your people, our people. I am happy to tell you that a number of people on the chat have said they were on the fence before they came, but they're no longer on the fence after this discussion. I think if we have at least if we've educated at least one person, then we have done something good because they will go back and tell somebody else. And thankfully, this video is going to be on for as long as possible, as long as it's going to be on YouTube and Facebook, so folks can go back and view it again and get some of their questions answered, and maybe reach out to you all. I mean, Dr. Gregory gave his address. I put it there in the chat. It's Gregory A. Vidal at gmail.com. So you guys go ahead and send him an email if you have a question. And I'm sure Dr. Nick is a big private. Of course, he used to be
No,
on
I
Facebook.
can share my email. That's fine.
All
So
right.
I can be reached at
No pressure. No pressure.
Shillingford9@gmail.com.
Can you tell us again? Sorry.
It's my first name followed immediately by my last name,
Okay, good.
9
Yes.
at gmail.com.
Awesome. So it's nickshilling49@gmail.com, guys. It's
Yep.
easy. So have good contact of our dear doctors, and we can all reach out to them. Take advantage. Don't abuse them, but I mean take advantage in terms of getting the proper information and references that you might possibly need. So once again, I wish you and your families continued safety and protection, asking the Lord to cover you all and keep your family safe for as long as possible. Give our love to Miss Vanilla, Greg, to your
Do
family.
that.
We just love you guys and appreciate you guys so much. So thank you. And we will reach out to you again, I'm sure, some other time. Don't be a stranger.
Reach out
Anytime you're ready
anytime.
to share new information, CIS will try to accommodate as much as possible. All right? So have a
Thank
blessed
you.
night. All right.
Have a
Take
blessed
care.
night. All right. Bye.
Yes, thank you so much. Yes. Okay, so my dear folks who have been with us, let me say to you, thank you for your patience. Earlier we had some technical difficulties, but you all stuck with me, and I'm very grateful. If you dropped out, I'm sorry. This is beyond me. Sometimes the internet is beyond me. It's not something that I have full control over. I'm still trying to fix this to give us a better sound, and hopefully by next week I'll get a little gadget from one of my good friends who is gonna probably try to tell me how I should do this, and hopefully the sound will be clearer and better to kind of silence the noise in here. Okay, so with that said, let me thank you once again. I want to also probably tell you guys that, hey, I have put it out there that I am available to edit your documents, to edit to write your CVs for you and your letters of application, or to tweak them and to fix them up for you for a good, reasonable fee, of course. Okay, so I'm putting it out there. You guys can check out my flyer, Seize on Demand. If you go to my Facebook page, you will see it. A number of things that I'm offering myself to do for you, and also my new book. I just published my third book. It's a book of poetry. It's my first book of poetry, but it's my third book that I've published, and you can find it on Amazon.com. It's just expression of my heart and the things that make me happy, the simple things, the mundane things, and also the sublime things from time to time. So I hope that you guys will take some time and support my little work that I'm doing. I call it little because, hey, I'm just a nobody from this little place, right? So go ahead and check out what I do. Go on Amazon.com, search for Caesarina Paul, and you'll find 3 books, all right? Thank you very much. Let me play my promo again for you so you can see the books and what they look like. So when you go and search for it, then you can see, oh yeah, that's it, that's what it is. So yeah, here was my promo. All right, so I sure hope that you saw that. All right, 3 books written by C's, and go out and support what I do. Thank you guys one more time. Have a blessed weekend. Remember, we are keeping our distance. We are wearing our masks, and of course, we are washing our hands as frequently as possible. If you protect yourself, then you protect the other person. That's how I see it. So if you love me, then you protect yourself. If I love you, then I protect myself and protect you in return. Let's go and make our country and our nation and our island better in the small things that we each do on our own. Once again, I thank our guests who served us tonight and all of you for being with us. God bless you. Thank you once again. And not next Friday, but hopefully on the first Friday of February, God willing, we should meet again with another community dialogue with C's Paul on influences. Let's go and influence somebody positively. God bless you.